Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about preparing for Q4 in healthcare. Are you prepared for the busiest and most critical quarter of the year? We are rapidly approaching the fourth quarter of 2025, and I wanted to do this video to talk about some of the things that you should be thinking about and working towards while we're approaching this fourth quarter, and what you need to be thinking about that you need to do in the fourth quarter, okay? So we're gonna go through some things. I have some notes. The first thing is that usually in most practices, Q4 can be a very busy time. You're going to see increased patient volume because you have a lot of patients that have used their deductibles for the year. They've met their deductibles, and they're going to want to get the most benefit out of their health insurance while they can before their deductibles start over. Because of this, patients are going to be calling like crazy, trying to get in and utilize their benefits. Again, if it's a specialty where patients usually have to pay a deductible, like orthopedics, podiatry, and I don't want to say it's an elective specialty because that's not the right word, but perhaps it's a specialty where people don't necessarily have to go immediately. They can put some of their ailments off for a while until they hit that deductible, because I know I'm guilty of that myself. Then you're definitely going to see this. If this is the case for you, if you have been practicing for a while and you notice Q4 is going to be kind of crazy, start talking now about increasing your hours or changing your hours to accommodate that, maybe hiring more staff or changing staff hours of the current staff you have to be able to take advantage of this demand. That's because right around the corner, we have quarter one of the following year, and deductible season will be here as well. And you want to try to capitalize on everything you can now to kind of keep a little nest egg of funds, if you will, to help your practice and your business carry through deductible of the following year. Again, we also have quarter four in the sickest time of the year, or one of the sickest times of the year. Kids are back to school, they're spreading their germs, we have cold and flu season coming, and we just get a lot of sick people going to the doctor. That is another reason, especially if you're in primary care, internal med, things like that, you're probably going to see an increase in patient volume during the fourth quarter as well. So just keep that in mind. You really want to stay on top of the insurance benefits and verification for the staff who are responsible for that. Maybe it's your front office staff, maybe it's a registration staff, but a lot of people have hit not only their deductibles for the year, but they could have met their out-of-pocket maximums as well. There is a high risk of over-collecting from patients if you collect upfront before services are rendered because of this. You have to make sure that your staff are checking to see where patients are with their deductibles. They could be very close to hitting their deductible. So when they come in to see you, part of their visit is going to go towards deductible, and then the other part is going to be coinsurance. And if you're collecting some kind of deposit or upfront cost by just looking at that deductible that's unmet, you could be over collecting and end up with patient credits, and you don't want to do that. Same thing with collecting copays. If patients have met their out-of-pocket maximums, you're going to end up with credits on their accounts, and that's not always a good thing. The other thing you would want them to do while they're checking these eligibility and benefits is somehow in your system, if possible, flagging that the deductible is going to start over January 1st, because that will not only tell you after the first of the year whose deductible started over, but it's also to make sure that you ask those patients if their insurance changed at the first of the year, because that deductible starting over means that's the new year for their policies. And if their employers or whoever they get their insurance from changes their plans or gives them different options, there is a possibility that they have a whole new plan altogether starting in the beginning of the year. So flagging those for a new deductible could also help make sure at the beginning of the year that you're double checking patients' coverage and that they don't have a different plan. Another thing that happens in the fourth quarter are the holidays. We have Halloween. Well, actually, it starts off with, I guess it would be, there's some bankers' holidays in there, right? We have Columbus Day and we have Veterans Day, but the big holidays, so we have Halloween, which a lot of people work, but some people might ask for it off, and it's on a Friday this year. So that could ask or encourage more staff to possibly ask for it off. Then we have Thanksgiving and Christmas. Depending on how your policies are and how your scheduling is, you might be closed the Friday after Thanksgiving, or you might be open and they only get Thanksgiving off. However it is, and wherever you are, you need to think about your staff and who's going to be asking for time off, or who might want time off, and what providers might want time off, so that you can make sure the staffing is appropriate to how many providers you have. But preparing now and having conversations right now with your staff and figuring out how you're going to determine who gets the time off if multiple people request it is something that you want to be prepared for, and not trying to wing it last minute. It also is good to make sure that your schedule for your patients reflects how many providers are in, who's on vacation, things like that. Because if you don't update that schedule now, you could possibly schedule patients for when their provider is not going to be available, and you're going to have to call them back. You could possibly make them upset, but you could also be mistakenly having schedules open for people that shouldn't be scheduled there. So anyway, I'm rambling, but you just need to make sure you're thinking about all of that. I did a recent video about this, but working your AR diligently in the last quarter is really important. I talked about checking your financials halfway through the year. That was my recent video. However, looking and forecasting ahead, you want to hit that AR hard in the fourth quarter. You want to clean up this year's messes and delays and deficiencies everywhere in the practice, not just with the billing, but that is a really good place to start, is making sure you're getting as cleaned up as possible and collecting as much money as you can, writing off anything you're not going to be able to collect on, so that you start the new year fresh. You need to have conversations with your providers and make sure that they are completing their chart notes as soon as possible in the fourth quarter, and do a very strong push of completing all your current year's claims to the insurances so that you can get payment on all of those. And that will also help with the money coming in during deductible season, because it will be paying for dates of service in the previous year where the deductible may not be applicable for patients. It's less likely anyway. And you can kind of sock away that money as well to carry you through the next year's deductible season. You want to kind of forecast what you think the cash flow is going to be for December, January, even into February, knowing that collections from patients are going to lag during that time. People spend a lot of money on the holidays. Sometimes funds are tight at the end of the year. And it's just kind of known in the industry that insurances pay slower at the end of the year and patients are harder to collect from at the end of the year. It's just kind of the way it is. And you want to make sure that you're anticipating that and kind of maybe thinking outside the box of ways to approach that and solve some of those possible delays so it doesn't impact you too negatively financially. January 1st is a big date when it comes to CMS changes of policies that they're implementing, HIPAA changes. It's a big time of year when a lot of things will come into play. So you want to make sure that you're staying on top of any changes that could be coming down the pipeline effective January 1st during the fourth quarter. So you want to make sure you're going to OIG's website, HHS's website, CMS's website. Your payer guidelines can change as far as what they cover in your specialty. You want to make sure you're staying on top of all of that. So you should be going through kind of a rundown list of all of the places that you would be needing to check that would have changes go into effect January 1st if they have any. Before year end, you want to make sure that you'll back up your EMRs if they're not regularly backed up already. You want to make sure if you use a separate billing software that's backed up. Anywhere you store electronic documents and communication. Work with your IT specialist to see if that needs to be backed up. It's good to have something in place that if something were to happen, but also wrapping things up at the end of one year and then starting fresh in a new year makes it easier to find things if you have to go back and look at your backups for specific information. Per my resource of ChatGPT, I was told, and I was not aware of this, but it makes sense, that Q4 actually sees an increase in cybersecurity breaches because they see a lot of phishing scams targeting healthcare organizations because of like compliance changes. They kind of hook you thinking that you're missing something and you panic. There are also situations where patients might be scammed because of all of the holiday hubbub and people are just kind of busy. And it's just one of those times that they see an increase. So you just want to make sure that you're checking with your security officer, your IT specialist, to make sure that everything is in place that should be, and reminding your staff that if they see a suspicious email or something like that, that they're not clicking on it. Just kind of reminding them of the smart ways of using technology. I have done separate videos about this, but it's a reminder that Q4 is a good time to start setting your benchmarks for the next year. You want to make sure that you have benchmarks for financial performance, staffing efficiencies, especially if you're looking at wanting to hire a new provider or purchase a large piece of equipment or something like that. It's a perfect time to try to put a budget into place. And then you also want to approach patient satisfaction and how you're either going to improve patient satisfaction or you're going to keep it good if you're already doing a great job in that, and making sure that you're not going to drop the ball anywhere either. It's good to have goals for growth of the following year after doing kind of a retrospect of how the current year has been. You want to see if there's going to be new technology that you might want to adopt. Maybe it's an AI thing. Maybe you haven't adopted AI yet, but you know it's a growing trend and maybe you guys are feeling more ready for it. You want to make sure you start doing your research on that to see if that's something you do have a goal of adopting in the following year. And what about service expansion? Maybe you guys have been toying with the idea of offering a Botox injection cash only service, and you're not sure if it's been at the right time, but if you forecast and kind of set goals, perhaps the next year at some point would be a good time. Things that you've been toying with, just readdress it and look at things and see if possibly it's a time to put a plan of action into place to adopt or implement something new. I see a lot of mistakes with healthcare professionals and practices where they're coming out of what I call the holiday hangover. And it's just kind of the slow time of the year as far as like people being on vacation and you don't feel super productive. But I mean, you see a lot of volume. It's just kind of weird. But it's just kind of sluggish at the starting of the year. And I encourage the opposite. I think that you have a mindset, you have a plan with your staff, your operations, that after December 31st, we hit the ground running January 1st. It's a new year. We're excited. You want momentum. And the more uplifting and prepared you are at the end of December to carry that momentum into January, and the mindset, and this is going to be new and this is going to be fresh and stuff like that, especially from the leadership team, is going to help you really do well during deductible season. It's a mindset, yes, but being prepared and maybe introducing some new exciting things at the beginning of the year to really like motivate people to want to do a good job and really help patients, that is what is going to make you very successful. So think about that. Think about what you could do in your practice to not let the holiday hangover kind of go into January and be ho-hum, but really like use January 1st as like a catapult to get you guys going and really be excited and enthusiastic about the upcoming year. If you have any questions or comments about that, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this video with your colleagues. I appreciate the support. We will see you next time. Bye-bye.